Authorities at the Antwi-Kusi Teaching Hospital say it has put in contingency measures to ensure uninterrupted emergency and elective services to the public in the wake of the ongoing industrial action by the nurse anesthetist. Head of Anesthesia and Intensive Care Directorate at the hospital, Professor Antwi-Kusi, tells JoyNews, though the action has overstretched the few available hands, the public is assured of uninterrupted service. Members of the certified registered anesthetists, in a letter addressed to the Health Ministry, announced the withdrawal of service effective January 1, 2022. But Professor Antwi-Kusi tells my colleague Ohiminteria of our health desk the situation could worsen if the issues are not addressed.
A team of physician anesthetists, supported by other health professionals, were busily preparing patients for surgical procedures at the Accident and Emergency Unit when the news team visited at about 8:40 a.m. on Wednesday. Physician anesthetists have taken over the work of the nurse anesthetists, and they do so with ease.
This patient has to have surgery on his lower limb, so we are doing a spinal anesthesia for that.
The doctors are unhappy with reports. CAT has suspended all emergency and elective surgical procedures.
We've been operating. We've never stopped operating. We were even operating throughout the season. So the information you had, unfortunately, was inaccurate. And that Antwi-Kusi has never stopped operating.
Members of the certified registered anesthetists say the strike is indefinite until government responds to calls for improved working conditions. At least 52 of them, mainly nurses, have withdrawn their services at Antwi-Kusi Teaching Hospital. This means trained physician anesthetists fill up the vacuum created by the absence of the nurse anesthetists. Head of Anesthesia and Intensive Care Directorate at CAT, Professor Antwi-Kusi, explains to JoyNews.
Those who are on leave were called in, and then we felt a fault. Usually when it happens like this, you have to stop elective cases and attend to only emergencies. But we've not stopped any elective case. We've not stopped any emergencies. We are receiving referrals from all over Kumasi and Ashanti region.
Professor Antwi-Kusi says the impact of the strike could be dire on district health facilities if concerns of the anesthetists are not addressed.
In fact, we have been stretched to the limit. Now we have some of the doctors taking care of the COVID patients at the intensive care. And then if you come to the normal intensive care unit here too, it's my doctors who are supposed to be working there. And then we have the normal OPD, the anesthesia clinics. So in the wake of this strike, I have to call some of them, and some of them have to work extra. Some have worked for 24 hours since yesterday, 8 a.m. Till today, and they are still on their feet working. So if this thing prolongs, then obviously they are going to break down. They can't cope, because the referrals are coming from all over. If you are doing 10 cases and now you are doing 25, 30, then you can see, how big the problem is.
For JoyNews, Ohiminteria.
A breast cancer patient, Aminatu Ibrahim, was scheduled for a breast surgery at the Wale Government Hospital, but the operation failed to come up because of the strike. President of the Certified Registered Anaesthetist, James Inwingasara, gives an insight on the impact of the strike at the various hospitals.
Many facilities, the district, regional hospitals, district hospitals have no option than to shut down the elective cases. And many of the emergencies that cannot withstand the place were sent to Antwi-Kusi, Kolebu, where they can have attention. Any other thing has come to standstill.
We know that you just met with CHAG. What was the outcome of the meeting?
We have not come to any definitive conclusion. CHAG came in as a mediator and tried to see how they will help to deal with the impasse. We have come to a level that is not taking the lead to meet the ministry. So we are reverting to the office and then waiting for any further information, and then we'll decide how we will respond.
So you are calling off your strike?
No, we are not calling off our strike.
Has the ministry or the Medical and Dental Council made any contacts?
Not at all. Not at all. So far as I'm concerned, as a union leader, none of them has approached me yet.
Let's go to the Northeast region and speak to correspondent Ilyasu Tanko. Ilyasu, you have been speaking to some of the patients at the government, Wale Wale Government Hospital. What have they been telling you? Hello, Ilyasu. Ilyasu, if you can hear me, you have been to the Wale Wale Government Hospital following this announcement, the strike by the certified registered anesthetists. We know that a surgery that was scheduled for yesterday was called off because of this incident. In fact, other surgeries had to be referred either to the Tamale Teaching Hospital or to the Konfuanochi Teaching Hospital, where we've heard doctors say they are overstretched. You have been speaking to some other patients. What have they been telling you about their situation vis-a-vis the strike?
Well, I'm saying that the patients are being referred to the Baptist Medical Center, which is a private health institution in Nalirgu, and others are also being referred to the Tamale Teaching Hospital. But because most of them have already gone through a lot of inconvenience before coming to the hospital, referring them has been, accepting referrals has been very problematic. And so most of them tend to reject this particular referral and tend to use the convenient means of treating themselves, and that is staying at home or visiting traditional healers.
And you have been speaking to health authorities. How are they managing this issue, and where are they referring these cases to?
Well, in Wale Wale, which is the major referral facility here, the hospital management are saying that it's currently faced with acute staff shortage. And so as I speak to you now, there's no any contingency measures in place to address the interruption of emergency cases at this facility. They are hoping that these anesthetists will call off the strike and come back so that they will start normal delivery of service in this particular facility.
Ilyasu, thank you very much for that update. That's our Northeast Region correspondent, Ilyasu Tanko, bringing us an update of the situation in the Northeast Region, Wale Wale Government Hospital precisely.